Have you ever smelled something fishy and said, wait, is this me? Or have you seen green, thick white discharge and panicked quietly? Your vagina does not lie. When something is off, she speaks up. Welcome to the Vagina's Mental Health series. I'm so glad you are here. In episode 1, we talked about the vulva versus the vagina. Episode 2, we looked at the do's and the don'ts of intimate hygiene and the occupants of the vagina. While in episode 3, we broke down vaginal discharge, what is normal and what is not. But today we are calling out the real troublemakers, the ones that brings itching, burning, smells, discomfort and confusion, not only in the vagina but in marriages and in relationships. Yes, I will start by calling names and let your name not be mentioned in this. And they include yeast, bacterial vaginosis, urinary tract infections, gonorrhea, chlamydia, and trichomonas. First, what's the difference between urinary tract infections and vaginal infections? I would like the men to take note for the fact that your partner has a UTI or a vaginal infection or has both of them doesn't mean that she has done something behind you. Please, you guys should take note of this because I've seen relationships scatter because of this. The vagina and the urinary tract are neighbors, but they are not the same. The vagina leads to the uterus, while the urinary tract is a little tube that takes urine from the bladder out of the body. Sometimes they both get infected, and that's where the confusion starts. Let's break it down one by one. The vagina has occupants that lives inside. We have the good bacteria, yeast, and the bad bacteria. When the good bacteria are in charge and you have respected the do's of the vagina, everything operates normally. Yeast is naturally found in your vagina, but when things go off balance, maybe from antibiotics, stress, tight clothes, or taking too much sugar, yeast overgrows. We had explained that in episode 2, part 1. This leads to a woman seeing and experiencing thick white discharge like pap or cottage cheese, intense itching, especially in the vulva, redness, swelling, burning during sex, or when peeing. You shout, you call your husband to come and help you. Usually, it does not have a strong smell. The next one is bacterial vaginosis. It is not caused by death or poor hygiene. Neither is it caused by your wife cheating on you or your partner cheating on you. It is caused by bacterial imbalance in your vagina. It presents with thin, watery gray and white discharge. It has that kind of fishy odor that you experience when you pass in the market where they sell dry fish. There is mild itching and there is no smell. Bacterial vaginosis is not a sexually transmitted infection. Men, take note, but it can increase your risk of getting one if untreated. It happens after you douche using harsh soaps. Those people that want to bleach it down there, they should be very careful. Sleeping with new or multiple partners can also provoke bacterial vaginosis. This one is not a vaginal infection, but many women mix it up. Urinary tract infections affects the urine and not the discharge. This happens when you wipe from back to front and bacteria from your anus enters inside your urethra or your pee hole. This presents with symptoms of you feeling like you want to urinate, and eventually when you go to urinate, you start shouting, honey, help me, because you feel pain during urination, and even when you urinate, only small urine will come out from, and also the urine smells and is very cloudy. It's important to note that you can have a vaginal infection and a urinary tract infection at the same time, but one does not automatically cause the other. Always see a doctor if you are unsure, okay? Now we'll be looking at sexually transmitted infections and the kind of discharge and smell they produce. The first on our list is gonorrhea. Sometimes there are no symptoms, but when it shows up, you will see yellow or greenish discharge, pain when peeing, belly cramps, and even bleeding between periods. If untreated, it can cause infertility. Please don't take flagyl without proper test. Go to a clinic or a hospital for proper testing and appropriation of medication. Chlamydia is the quiet one and the silent infection, and many women don't even know they have it unless it starts presenting symptoms. It could be watery discharge, pain during sex, or bleeding after sex. At times, you will have cramps during menses. It spreads fast, and if ignored, I bet you it can block your tubes. It can cause pelvic inflammatory disease, stillbirth, and it can cause miscarriages. And when we have trichomoniasis, also known as trish baby, you will know that you have it. Oh. It is very loud. When it comes, you will know. It will shout its presence. This one presents with frothy yellow or green discharge, very repulsive and strong smell, and painful sex. Omo, these infections can look alike oh, but they are not the same. So don't guess. Don't take medication of your own oh. We don't want to hear that you have taken agbo or flagyl by yourself. You are not a doctor. Go for proper checkup. It's always advisable that you see a doctor when your discharge presents funny colors and have funny odors. This is just the beginning and we are about to go deeper. Coming soon, I'll be breaking down sexually transmitted infections by their real names, the ones caused by bacteria, viruses, and parasites. I will talk about how they enter the body, how they behave, and the right test to request when you go to the hospital. I will also talk about those scary moments when someone tests HIV positive by mistake, why it happens, and how to know the truth. If you have ever been confused about symptoms, test results, and what to do next, stay with me. Have you ever experienced unusual discharge and you didn't know what it meant? Please don't be shy. Let's talk about it in the comment section. And don't forget, in episode 5, we are diving into how your diet affects your vaginal health. Yes, what you eat affects the way your vagina behaves. This is the Vagina's Mental Health series, and we are just getting started. Bye.